Thank you so much. Before I start my talk, I just have to say, women, this is your hospital. The only hospital in Ontario, pardon me, the only hospital in Ontario with a primary focus on care for women, and one of only 3 in Canada. We're going to be opening the main entrance in the Pink Cube in about a year and a half from now. But we are there. We're still providing extraordinary care for women. On my board, I have 24 women and 2 men. On my senior team, I have 8 women and 1 man. 80% of my medical leadership are women. It's your place. It's our place. Now, I'm going to say thank you for having me. It's an honor to be here. What could be better than being in the room with almost 300 women who are committed to their own leadership and to the leadership of women? You know, whenever I'm asked to speak on a topic of leadership, I always find I advance my own learning. And I have to tell you, in the past few days, I've gone through a process of relearning old lessons that I'm going to tell you about. It made me think I wish I'd done this a couple of years ago. This is going to be an old story, but I want to share with you some priceless and actually timeless lessons. It's a story about risking the present for a powerful future. And it's also a lesson that failure is not what will sink you. It's all about what we do in the face of failure. So speaking about the face of failure, that's me. On the front page of the Toronto Star, December 16th, 1999. My hospital was rated the worst in the province of Ontario. I was a fairly new CEO and had been at this hospital for about a year and a half. I'm not speaking out of telling tales out of school. This is a very public story. I had been at the hospital about a year and a half, and through that time we knew that there was going to be the first public survey of patient satisfaction of hospitals in Ontario. And it didn't take me long in this new organization to recognize that this was not going to go well for us. I had spent a great deal of time talking about it, communicating it. It really was myself and my board that got the state of affairs. Leading up to this public, very public report card, I came away from this knowing that this was going to be a very difficult time. I had, in my previous hospital, been the CEO of a hospital that was an award-winning hospital. Our first accreditation survey had put us in the top 2% of hospitals in Ontario. We were the first hospital to win the National Quality Institute Canada Award of Excellence. One of my idols, Tom Peters, wrote about my hospital and our success in his book, Crazy Times Call for Crazy Organizations. And this is me in the book. So that's what success looks like. That was in 1994, 4 years earlier. Anyway, sorry. Back to failure. This was another headline, and you can see the sub-headline, "My hospital was worst in the province." I had had a rough time trying to turn this around. I had come to this hospital from, as I said, from an award-winning hospital, and I was speaking into hundreds of staff that were really saying, who was this woman from Markham coming here and telling us what we're doing wrong? We had 100 reasons why the state of affairs was the way it was at this hospital. We were different. We had a faith-based mission. We were better than others. Our patients are sicker than others. All of these beliefs served to keep the evidence out that we weren't doing very well. The survey data was wrong. Many of my colleagues and many of my folks in my organization were wanting me to dismiss the survey data. And I actually could have poked holes in it because there were problems with it, but it didn't matter. It was very reflective of the situation that we found ourselves in. By the way, all of these reasons why also serve to have you not be responsible for the state of affairs. There are other reasons as well. We can't do this, we can't do better because our building is old, we're underfunded, we had a lot of reasons why. I found myself, just before this headline came out, I found myself really with nothing left to try. Having come from great success, I had a whole lot of things that I thought that I could bring to the table to make a difference. The one thing I had to do was move outside of myself to figure this out. So I brought in a coach, and this was, when I talk about risking the present for a powerful future, bringing in an outsider into this old organization, not only an outsider, but a master coach in transformation who was American, who actually cost a lot of money. But one needs to ask, well, what is it worth to serve your patients and have them be satisfied? Anyway, found a master coach. And my first meeting with him, I spent about an hour and a half on the phone telling him. It took me an hour and a half to tell him about all the problems. I had come from a hospital that was award-winning. We had a strong culture of accountability. Now I was dealing with a culture of entitlement, a culture of being victims of circumstances, culture where everyone believed that they were actually better than others in the business, a culture of insiders versus outsiders. The average length of service in this hospital was quite different, quite along the way, something like 20 or 25 years. And I had been there about a year and a half, and I was going to be an outsider for a very long time yet to come. So I took about an hour and a half to tell him on the phone about all of these circumstances that I had actually been ineffective in changing, and that what I really needed to do was put an end to this victimization and culture of complaining and blaming. So I finished my story, and there was a long silence on the end of the phone. And after, I think, about 30 seconds, my coach said to me, "Do you mean like what you're doing right now?" You could have knocked me over with a feather. My whole world changed in an hour and a half phone call. And actually, one sentence, "Do you mean like you're doing right now?" I was not being responsible. I was talking about them, not me. This is not my hospital. This is not the care that we provide. So I had to learn that fundamental to this was my being responsible, my being willing to make a difference, and actually getting very, very clear about what I'm committed to. Because up until then, I had been committed to making everybody else wrong. So once that happened, there were a series of things that we did. And I'm not going to dwell on these. These are actually a whole other talk that could take an hour or two. But we conducted a whole series of things. We worked with staff over many, many weeks to allow them to identify for themselves the reasons why we were in this situation. That really got them to own it themselves. Identified simple solutions, got some key champions participating. We had to improve the physical environment because you have to put your money where your mouth is. If you're talking about satisfying patients and respecting patients, you better make sure your air conditioning is working all the time and your toilets aren't plugged half the time. We identified and dealt with some physician issues that those of you that work in healthcare, you know there's this constant tension between staff, administration, and physicians. And we made a requirement there would be no physician bashing going forward as we dealt with this. And then we sprang into action. We did things like actually measured on a weekly basis patient satisfaction. We set targets. We provided real-time results for staff. We required an immediate feedback loop. Managers were required to deal with unsatisfactory issues in 24 hours. We allowed staff to analyze their results, and then we publicly posted them. Staff really began to own the challenge. They let us know, they started to let us know about peer pressure that they were dealing with, circumstances of bullying, some unaddressed competence issues. This was really fundamental and really important. The next step to my recognizing what I owned in this was them recognizing what they own, because you can't re-engineer or change manage on top of anger, blame, upset, cynicism, resignation. Our staff had become resigned about many, many things. So I just want to tell you that the researchers who developed the patient satisfaction survey, they were grounded at the University of Toronto and the Ontario Hospital Association, done a lot of study in this area, and had said setting about to turn around patient satisfaction would take 5 to 10 years. That was the experience and that was the evidence. And I want to show you we did this in 6 months. Six months. Because it's all about owning it. Critical success factors were owning the current state. As I said, I had to see how I had become like everybody else. And I had to learn, and I learned in that moment when my coach said to me, "You mean like what you're doing right now?" That the heart of transformation, the heart of change and transformation of this magnitude is owning the current state. I also put structures of support in place, which was necessary because we're human, right? Owning the current state is great on day 1. It's hard on day 7. This is what I learned, and what I have to confess to you, I've relearned in the last few days in preparing this talk, because I hadn't looked at this for a while. And I can see how things that I've been struggling with have to do with blaming. That's a hard one for me. No blaming. So, owning the current state, being all about being responsible. And by the way, that photo of myself on the front page of the Toronto Star was actually a major step that I took in owning the current state. When this was published, this report card, it was a very, very big media event. The Ontario Hospital Association asked me to be one of 4 on their media panel. They didn't know what my results were going to be, but I knew what my results were going to be. So the easy and perhaps smart thing would have been for me to decline being on the media panel, but I didn't, because that's the first step in owning it. So, no blaming, no excuses, no myths. We had a lot of myths going around the hospital. All of these reasons why we had 8-hour wait times in our emergency department, blaming other departments for it. Well, the beds aren't turning around fast enough upstairs. That's why we're keeping patients waiting 8 hours downstairs. We busted that myth because we went and measured how fast beds turned around. They turned around in 20 minutes, which has nothing to do with an 8-hour wait in the emergency department. We also dealt with stories. No more stories. What's a story? A story is what I spent talking to my coach on the phone about for an hour and a half, talking about them, they, gossip, criticism, negativity. The structure of support that was very important was my board of directors, or in many of your cases would be your boss. I asked them to make a public declaration that their top priority was patient satisfaction. My request of them was that they actually be ruthlessly compassionate on this issue. No excuses, no backing down, no matter what. I could have, if I wanted to, stayed in all the excuses, and lots of folks would have bought it. But I had to say to them, don't allow any excuses. Don't back down on this. Hold me and the Chief of Staff accountable for patient satisfaction, no matter what. And then the next day I thought, what the heck have I done? And then I said, please be compassionate, because this is not easy. So that's my story. I'm going to end with my next to final slide, is shifting over, shifting over to the advice that we give one another as we're entering into our own professional journey, all of which is very good advice. Mentoring is so important. I actually have had the honor of being a mentor for the WXN mentorship program. Seeking mentors and having mentors and being a mentor is incredibly important. Networking, like you've been doing here, planning your career, leadership development, and of course, do what you love. Not all of those things were necessarily available to me as I would have wanted them when I became a CEO for the first time in 1989. I was 38 years old. Mentors were older white men in my business, and weren't all good CEOs, not necessarily the kind of CEO I wanted to be. So what worked for me in the absence of the mentors that I would have liked to have had is I did a lot of observing for what I aspired to be. Picked and chose. Didn't matter whether you were in healthcare or outside of healthcare. A lot of observing, and then internalized that and worked with that. Networking, it just wasn't what one did in 1989, although it's importantly well available today. Doing your homework when networking isn't available, or as an adjunct to networking, is something that was of great value to me. I did not plan my career, and it's not that it's not an important thing to do. It definitely works for people. I did not plan my career. I didn't know that I was ever going to end up as a hospital CEO. In fact, I said for many years it was something I never wanted to do. But I did seek leadership opportunities and took kind of a bit of a winding road to the top. And when I got in a position next to the top and watched the CEO and how he operated, I realized pretty quickly I actually, on many, many things, knew more than he did. He was just really good on his feet. Leadership development, also great, very important. What's worked for me is I have spent my entire working career focusing on leadership development that's not traditional, but that actually helps you to gain insight into yourself and the impact that you have on others. Being responsible for the emotional wake that you leave is perhaps the most valuable thing for you as a leader. Do what you love, and I would also say love what you do, because you can't always do what you love. Being a CEO of a hospital or an organization or a chief operating officer or a middle manager actually doesn't matter. I have to do what matters. Running an organization doesn't matter. Running a hospital is not a legacy. but doing what matters, finding in your job what matters and what makes a difference and what will last is what your legacy can be. Aim for the title, aim for the job, but focus on doing what matters. Thank you. I just want to say again, there have been some important lessons here in my preparing this for you today, so I want to not only thank you for your time, but thank you for the opportunity to relearn as I go back to my organization tomorrow and give up the blaming.